message finds you and your family and your practice as well in weathering our most recent storms. I wanted to take a moment and personally thank you for your partnership with UNC Health Alliance, whether you're a new partner with us or one of the more than 100 practices who have partnered with us for all of the past 5 years. As we welcome 2022, we recognize the impact that COVID has had on all of us, our practices, our patients and their families, and the communities that we all serve. I hope that it's now time to think about recovery, however. We at Health Alliance are looking to the future to address the new challenges COVID has presented, as well as tackling the issues that COVID has shown a bright light on, like the real impact of social drivers of health and the significant health disparities that we can no longer ignore. Together, we look forward to a successful year in 2022. Each month, we've shared with you our COVID predictive model, which has been really quite accurate over the past 18 months in predicting how the surges would evolve and then when they might end. And even as recently as this week, the model continues to show a sharp decrease in hospitalizations due to COVID, both within the UNC Health Network, but also across the state. And this allows us to see the light at the end of this very long COVID tunnel. We know, however, that many of our patients have delayed care through all of this, and we're actively anticipating how we might address those delayed needs. We're using a data-driven approach to identify who's missed key preventative care, who has significant gaps in managing their chronic disease, who has defaulted to seeking care in the emergency department when they might benefit from more coordinated care in our primary care offices, and who might need extra support now more than ever. We're also acutely aware of the other pandemics COVID has introduced or exacerbated. Social isolation that many of our patients and their families have experienced and continue to experience, the behavioral health struggles many of our patients and families endure, and the crisis in staffing of our nurses, doctors, and other care team members. I'm sure all of us are feeling that. Throughout this pandemic, we've talked about how to support our teams and ourselves in what we've called self-care or wellness, taking care of ourselves so that we can take care of others. And although I hope that we're seeing the end of this current COVID surge, it's never been more important that we take care of ourselves and that we recover ourselves. Throughout this pandemic, the UNC Department of Psychiatry has developed resources to help providers focus on wellness and to help through signs of stress or even more significant burnout. We're really pleased to share that our UNC psychiatry colleagues have made these resources available to all providers across our network. And we'll share the links to these resources in this network newsletter. And they include several things, like the Hope for Healers support line, which provides emotional and mental health counselors available for phone or chat conversations, other peer support programs, and many self-directed tools and videos, and even a suicide prevention lifeline. I particularly like Dr. Karen Bluth's Intro to Mindfulness series on YouTube, and I found that really quite helpful. I encourage you to take a look at these resources and hope that you find them valuable and useful as well. We really appreciate all that you do every day to care for your patients, their families, and your communities. And we really deeply value your partnership with Health Alliance and the really good work we've all done together over the past years. Thank you for partnering with us on this journey to deliver the highest quality, most accessible, equitable, and affordable care that our patients and their families really deserve. Please enjoy this edition of Network News. We hope it's full of information that is useful to you and informative. And thank you very much